Hello, my name is Judy Squires, and I'm the Program Director of the University of Pittsburgh Medical Center Diagnostic Radiology Residency and the Associate Program Director for the Integrated Interventional Radiology Program. I am so excited to share with you why I believe that UPMC radiology training is one of the best in the world. During medical school, many of you probably had experiences similar to me, where a challenging clinical case stumping the care team was suddenly clarified once you went down to discuss the patient's imaging with a radiologist. That ability to correctly and confidently interpret the imaging to optimize patient care inspired me to want to be a radiologist. And here at UPMC Radiology, we look forward to training you to become that expert. Our expectation at UPMC is clinical excellence, and our residents consistently meet and exceed this expectation. We accomplish this at UPMC by focusing on a few key areas. First is learning to interpret the studies well and perform the procedures well. Then we gradually increase responsibility and trust over time to enable you to become confident in your abilities. We help you find your passion within radiology, and we do this all while focusing on resident wellness, emphasizing growth as both a radiologist and an individual. At the core of diagnostic radiology training is learning to efficiently interpret studies in a way that maximizes the care you provide to your patients. As a large healthcare system with multiple locations across Western Pennsylvania and beyond, UPMC is well positioned to provide a high volume of both straightforward and highly complex patients. The core academic facilities where you will rotate are all located at or near our main Oakland campus. These include the Presbyterian and Shadyside Hospitals, McGee Women's Hospital, Hillman Cancer Center, and the standalone Children's Hospital of Pittsburgh. At each of our locations, our residents get to see and do a lot, all while working elbow to elbow with subspecialized faculty who are experts in their field and who are committed to resident education. Responsibility is given gradually but consistently over time. You will learn a ton, but you will have fun doing it and will be supported through the entire process by our exceptional faculty who are committed to providing world-class teaching, which is reflected in the performance of our trainees. Our residents consistently excel in their clinical endeavors, whether it be in the reading room, in performing procedures, in their performance on certification and credentialing exams, or at imaging competitions at national meetings. Equally important to the hands-on learning our residents experience are the many opportunities outside of the reading room. We have excellent, carefully curated daily noon conferences, review sessions, and morning case conferences. You will typically have up to 2 hours of lecture per day. Although most of these conferences are core imaging interpretation and intervention preparation, we also have business of radiology lectures, financial literacy lectures, a dedicated research symposium, a diversity, inclusion, and equity lecture series, as well as wellness series, including discussions of work-life balance. First-year radiology residents also take part in a fundamental-specific lecture series to help start off their radiology training, which is led by the experienced senior residents. Our residents also participate in multiple simulation-based learning sessions to learn how to use interventional guide wires and catheters, perform ultrasound-guided biopsies, and manage contrast reactions. Our state-of-the-art Wiser Simulation Lab enables residents to gain critical experiences in a controlled environment, preparing our trainees to be able to manage any of the various situations that may arise in clinical practice. An essential learning opportunity here at UPMC in the Department of Radiology is the preservation of independent call. Independent call begins in the second year of residency after the fundamentals of radiology are solidified, but junior residents are still paired with more senior residents for additional support. Independent call builds confidence in your ability to tackle challenging scenarios. We believe in giving our residents gradually increasing responsibility and then trusting our residents to use the knowledge they have gained. We believe in our training program and in our residents. The continuation of independent call at UPMC speaks to this. As a program director, I can easily say that the greatest exponential growth I see in our residents comes during independent call. Although our residents are at the forefront of patient care, there is always subspecialists attending backup available for help when needed. Collaboration and developing professional relationships with clinical colleagues is another imperative component of the learning that occurs during your residency at UPMC. Our residents build close relationships with our excellent clinical services. This includes with our ICU colleagues, where trainees complete an ICU-specific rotation, functioning as an expert imaging consultant during rounds. The residents also participate in various multidisciplinary conferences and experiences throughout their residency. We repeatedly hear from our residents how impactful these collaborations are in their residency experience. In my area of expertise, pediatric radiology, we have a dedicated tumor board with our pediatric oncology, pathology, and surgical colleagues, which fosters collaboration and encourages one-on-one dialogue. I can say from my perspective that my interactions with these fantastic physicians within and outside of tumor boards have made me a much better radiologist. At UPMC, there are ample opportunities to find and develop your academic passion. We have many residents actively involved in research, publishing manuscripts, writing grants, and presenting at national and international meetings. Several trainees work with our Artificial Intelligence Research Lab, Radiomics Lab, and our robust Radiology-run 3D printing lab. There are also several long-standing peer-to-peer teaching opportunities in our program, with residents giving several conferences and teaching sessions in our simulation programs. Our residents also have many teaching opportunities involving junior learners at the medical school, undergraduate, and even high school levels. We have many residents teaching in both elective and mandatory rotations, as well as in the anatomy lab at the University of Pittsburgh Medical School. We have had several residents participate in international collaborative teaching efforts through programs such as rad.pitt.edu International, which is a nonprofit organization aimed at increasing and improving imaging in low-resource and underserved areas. If you already have, or if you develop a specific career interest, you will find support and mentorship in that area at UPMC. The final and most important cornerstone of radiology training at UPMC is resident well-being. We have high but attainable expectations of our residents. Our radiology residency is challenging and transformative, but always in a very supported way. Incoming residents are not only assigned a faculty advisor, but also a senior resident buddy for extra guidance on a more informal level. We have a robust resident-run wellness committee that helps plan a myriad of fun activities outside of work. Residents have access to the entire UPMC institutional wellness programs, as well as multiple opportunities through the University of Pittsburgh. More importantly, there is a culture here of friendship and support. Our residents form lifelong friendships with each other. They volunteer together and study together. They rely on each other and they support each other. They celebrate each other's successes. Quite frankly, our residents are the best part of this program. As program director and faculty member, I am so excited that you are considering UPMC for your radiology residency. We have a truly terrific and complete training program, which is reflected in the success of our graduates. In fact, many of our graduates have gone on to become respected leaders in our profession. As the program director, I can attest to our program's commitment to train our radiology residents to become the radiologist other doctors rely on to diagnose and treat the most challenging patients. Thank you so much for looking at our fantastic program. I look forward to seeing you in Pittsburgh.